Hello, and welcome to another edition of A Lot of Help with James Lott Jr. I am James Lott Jr., a certified life coach, former nurse, professional organizer, and media empire host or something. I do all these things. And I said a former nurse. And so I bring somebody on. We're going to talk about health and wellness. And she is somebody we met and we became friends. And I'm going to bring her on. She's from Irvine, but originally from Canada. Them Canadians are so nice. I love the Canadians. They're very nice. I've never been to Toronto, but I've been to Montreal. Well, it's not that far right from there. And so she's all about being proud to being you. I love that whole concept. She's a functional medicine chiropractor. So I like that also. And Dr. Haleh. How you doing, doctor?
Doing amazing. How are you?
Good, you look great. So I always ask people, just because this time period is so strange, how are you doing with all this stuff?
I'm doing good. I have my routine. I wake up, I meditate, I put on my red lipstick.
Like, hey, she's got on. Right.
I try not to watch the news too much, but I'm prepared. You have to be prepared and be informed of what's going on. And I'm still working from home. People need to work on their health right now. So bring down their stress levels, work on their health, eat healthy, take their vitamins, and, do things, read a book, spend time with your family.
Paint, do a puzzle, whatever. It's like, just do stuff. But I was gonna ask you, so obviously you're practicing what you preach, I'm sure. You're like taking care of yourself, eating a certain way, we're gonna talk about the stuff later in the show, but like you're taking care of yourself mentally and physically?
Yeah, of course. Number one person you have to take care of is yourself so that you can be an example to help, other people. So you have to take care of your mental health, your physical health, and, do things that make you happy.
Yeah, I'm doing the same thing. So I've been home 29 days. I have not left my house to go anywhere. I'm very fortunate. I have a big home with a big yard. So I go outside. I go to my yard. So you see some of my stuff in my garden. I post my garden photos and videos on Instagram and stuff. So I'm very fortunate. But I, at the same time, made a decision in the beginning. I wanted to lose weight. I've lost 10 pounds so far.
Good.
Thank you. I want to do like a couple pounds a week. I was trying to do like little by. I'm not trying to lose a lot of weight in one time. I'm trying to do little by little. Take my vitamins. We're going to talk about some stuff that you're going to suggest to us. And just eat differently, get some exercise. It was kind of rainy and cold last week, but I did get outside when it starts being sunny and I kind of get my out there so I don't get sick or anything. But I agree with you. I think this is a time for us to not just sit and watch the news 24/7. And we already have anxiety. We're going to talk about that. We already have anxiety. We already have a little worry. And that can affect your body. It can affect how you move, and you can hurt yourself easily, can't you? That kind of stuff when you're anxiety ridden.
Yeah. It basically, when you have that fear and fearful thoughts, it stimulates your cortisol hormone, and that just like increases inflammation, damages your gut. Your gut is your second brain, and it just makes you gain weight, crave more sugar, and it's not a good situation at all.
I learned how to trust my gut. I had a situation years ago where I hated my job. Like I literally hated my job for like the last 6 months. And my stomach hurt every day. When I quit, stomach stopped hurting.
It's so crazy. So there's two different hormones. There's a dopamine hormone that basically is a motivation hormone. It, you want to like get your tasks done and everything. Then there's a serotonin hormone. And a lot of those receptors are in your gut. So basically by, eliminating the stress, obviously that comes first, but you got to eat properly, and, you got to feed your gut the foods that it needs.
Yes. Okay, so you are a functional medicine chiropractor. Can you please explain what that is?
Of course. So functional medicine is basically, we find the cause of why you're not feeling well, right? So you're different than me. We have different health issues, and by finding the cause, we do blood work. We test the gut. So we do a stool test that basically tests for bad bacteria in your gut, how much good bacteria you have, fungus in your gut, okay? So a little bit is normal, a little bit of fungus is normal, but when you eat like sugars and starches, it feeds the fungus and it gets more and more, okay? Some people have parasites. I've seen it all, right? If you're digesting your food properly, and basically, if you have bacteria, I give you natural solutions to kill the bacteria. Okay, same thing with fungus, same thing with parasites. So we give you natural solutions to what is causing you to not feel good. Okay, we also test hormones through a saliva test, which basically we test that cortisol hormone. Usually cortisol is higher in the morning and then it trickles down at night. If you have lower cortisol, you're going to have issues with, let's say, your blood sugars, anxiety, your stress response, your metabolism. Same thing with if it's higher. So basically, I have natural solutions to put that into place as well. Okay.
Oh,
So,
okay. Oh, functional. I mean, I just want to break it down for a second. So it sounds really simple to me. It's like functional. We're going to try to find the functions of your body, the functions of your gut. What's causing things to happen down there. And I guess you said fungus. I didn't know fungus was in there. I knew about bacteria and stuff, but fungus is in there too. Okay. So that's what you're trying to find the cause. Now, please continue.
Yes. So basically, you know, again, everybody is different. What I do, it's customized. So we do a customized diet. Not everybody's like the diet is right for everybody, right? So based on the blood work, checking the gut, checking the hormones, we give you a customized diet and customized supplements. You need different things than I do, right? So I've seen amazing results with like 80-year-old patients that, you know, were type 2 diabetes, diabetic. They've gone off of all their medications. So obviously with their medical doctor's approval, you know, so at any age, your body is capable of healing given the right, you know, right combination of diet and supplements. So, you know, type 2 diabetics, I've helped autoimmune patients to put it into remission, like rheumatoid arthritis, lupus, you know, anything that attacks the body. And right now, the coronavirus at the really dangerous stages, it's attacking the body. It's becoming like lupus. You know, so, and people that are obese, people that have type 2 diabetes have a higher risk of dying from it. You know, it's so sad, but you know, this is all reversible with diet, you know, managing your stress and the right supplements.
I agree. I was 80 pounds heavier so than this.
Wow.
And over the course of a couple of years, I lost the weight little by little. And that was something, it didn't hurt that I got Bell's palsy in the middle of it all. And I couldn't eat as much for a few months. I mean, it did help a little bit. And I did look into, you know, I think it's funny you say it, because I did look into, because basically it was inflammation. My cranial nerve collapsed, inflammation happened. So I was looking at what I should take for inflammation. And they were talking about like vitamin B12, and all these, they named all these things. It was like, I got a kind of a minor course in that certain vitamins, certain supplements can actually work for certain things. There's certain teas that I drank. And again, I worked with my doctor. You know, I always work with my doctor to make sure it was okay, because I have high blood pressure. So I worked with my doctor to make sure it was okay. But you're right. I mean, I was like, so before I was like, that could help this. And now I believe it. I completely am sold that some things that are natural, because it makes sense to me, doctor, that you put things that are natural in your body to help something that's naturally in your body, right?
Exactly. Like your body, you have a cut, your body heals it and you don't even think about it, you know? But if you're not on the right diet, if you're not, you know, if your vitamin D is low, it's going to take a long time to heal it.
Yeah,
right?
I noticed that. When it's about your calcium levels, your iron, your body reacts to all that stuff when you're low, when you're deficient in it, or low levels in it. Your body. That's the thing I've always learned, that listen to your body. Your body tells you stuff, doesn't it? It tells you what it needs, right?
Yeah. So if you have pain, you have inflammation, right? If you have anxiety, depression, you know, something's going on in your body, right? It's, yes, it's your thoughts, but it's also your nutrition. It's also, working on the gut helps with anxiety and depression as well, giving the right vitamin D. Everybody, majority of people in the US are low in vitamin D.
Yeah.
That's the first thing you should check if you're depressed.
Now, explain to people, just in layman's terms, what is a chiropractor? Because some people are like, I don't know what that means. What is that? What do they do? They don't, they crack backs. What's going on? I mean, they don't know what that means. So please tell people what that means.
So chiropractors, we're doctors, right? But we just don't prescribe medicine. So our whole thing is we want to treat the body as, a whole. We want to heal you naturally. Okay. So we know how to diagnose your musculoskeletal nerve issue. So somebody that comes to me, I do a full examination, right? To check if they have a nerve issue, if they have a joint issue, if it's a muscle issue. And if it's a joint issue, adjustments really help. If it wasn't for chiropractic, I would be on all kinds of pain meds, for my back and my neck. So if your joints, we can feel to see if anything is out of place, and we pretty much put it back into place, right? We give you a treatment plan. Adjustment isn't for everybody, right? That's why we have to assess you, do a health history, do a physical to make sure it's safe for you, right? Then we tell you, okay, this is what we need to do to get you better.
My granddaughter's seeing a chiropractor right now, so from a sports injury. Yeah, she's seeing one. She's a teenager, seeing one right now, and she feels better. She loves it. So I've been seeing it for a while. She had a couple of concussions a while back, and she plays volleyball and soccer. It's so she's seeing a chiropractor right now. My daughter said something like, "Well, I mean, I guess they're real doctors." I'm like, "No, they're real doctors." So tell us, you went to medical school, correct?
Well, it's not medical school, it's chiropractic school. Okay. We have to do an undergrad of 4 years. I actually did psychology because I love the mind.
Okay.
So I did 4 years in Toronto at York University, and then you do another 4 years in chiropractic school. So chiropractic is not we're not regulated by the government too much. It's a private school.
Okay.
I went to one of the best schools in Toronto called CMCC, research based and everything. And it was a lot of work. We have to know everything a medical doctor knows.
That makes sense to me. Makes sense to me.
Yeah. Plus adjustments.
So I mean, okay, so why this field? You say you like psychology, but why chiropractic field? What appealed to you for that?
Basically, I had really bad neck pain. And, my sister is actually a chiropractor as well.
Okay.
I got introduced, by her to chiropractic, and, both from her and from my neck being healed with the adjustments, I loved it. I wanted to help heal patients naturally, and yeah, the mind is great, but the body is great too. So I put my knowledge with both of them together to help patients. I love helping people.
Yeah. Okay, I said this earlier, it's a little side note. I love Canadians. I've been to Canada. I won't say Canada. I've been to Canada twice. I've been to Vancouver on one end, and I've been to Montreal on the other end. So I got to see two different sides. But yet everybody was clean, friendly. I mean, all this stuff. What is one thing that you think is a plus about you being Canadian in your field?
A plus. I mean, we are super nice. And, coming from Canada to the US, I mean, it's similar, but it's definitely different. It's a different world in different aspects. And my knowledge, going to the best chiropractic school in Canada, being raised as a Canadian, I'm proud to be a Canadian, and I'm grateful to be in the US. I love California. So I think, I think it's just another, I'm grateful to experience being from Canada. It's cold. That's the only thing I hate it.
You guys look like us, but you're not us at all. It's crazy. I feel like the attitude is very different in Canada. Like we have a lot of baggage in America, like American history, a lot of baggage we carry with us. A lot of us carry that every day on us. And I feel like Canadians don't have. They have their own histories and stuff, of course, but I don't feel like it's the same like Americans. I feel Canadians are a little more lighter than Americans are, kind of. I always feel that. So I think that's a plus. That you come with adaptability because you came from somewhere else and you're here. So you can probably talk to all kinds of people. You seem very friendly and personable, so I'm sure you talk to all kinds of people. So that's a plus.
Yeah. We are very friendly. We are very humble. You know, and we're not as like, I feel like, political like than you know here. And again, like very friendly. I have so many friends in Canada that I still keep in touch with, and the only issue with me was the weather. You know, 6 months out of the year it's cold.
I know. When I went to Montreal in the wintertime, I had a free ticket. So I was back in New York. Montreal's right up there, not that far away. It was like a 2-hour whatever, and I was there, and I was like, it's a little cold, but I enjoyed myself. I didn't stay in my hotel. I enjoyed myself. I had a good time. But I mean, I was like, I want to go back. I want to go to Toronto. I have friends in Toronto, and I want to go. And I heard it's a nice, big, broad city. I heard it's very diverse. I want to go there.
Yeah, for sure. I'll let you know the cool places to go.
Good. Deal. Okay, so let's talk about. I just want to talk. Now I want to talk about actually some of the things, like some of the supplements, things you're talking about that actually help with inflammation, with type 2 diabetes, all the different kind of ailments that we have. That a lot of times we go strict to pills. It's like the name of the game. It's like, okay, you got this, get you a pill. And I think you have other ways of kind of approaching that, don't you?
Of course.
Let's talk about one of them for sure, and that's this vitamin C thing, right? That you were telling me off camera.
Yeah, so basically my products are liposomal. They're in liquid form. Vitamin C basically in liposomal form, it goes straight into your system through your mouth, into your cells. And actually something that people that don't know is vitamin C actually upregulates the glutathione pathway, which is glutathione, a lot of people don't know about, is the master antioxidant. That actually is, you know, vitamin C helps that pathway, which actually helps with upregulating your immune system and, you know, fighting against viruses and bringing down inflammation, helping with type 2 diabetes, insulin resistance. So what that is when somebody is type 2 diabetic, basically your cell has 2 receptor sites where insulin and glucose go in to produce energy, okay? When you're diabetic, that is blocked. And what we need to do is we need to open that up so your cells are producing energy. Glutathione really helps with that, obviously with the right diet and, you know, the right protocol. But what the medications do is they don't fix that issue. Okay, so metformin brings down your blood sugars. Metformin, what happens is it stops working as much, the dose keeps going up. That pill turns into another pill, glipizide, then that turns into insulin. Okay, so you know this is not a quick fix. You know, for these patients, we got to find out what's causing your insulin resistance, give you the right products, and you know, get you off of your medication.
Okay, so is the liquid form you think better than actual tablet form?
Yes. So the liquid form, basically the liposomal delivery, again, goes into your system through your mouth, and it prevents the supplement from being digested from your juices, from losing in your digestive system. Yeah. So, you know, it's actually better. It's 100 times better than IV too. So it's like, okay. It's amazing. It works wonders.
When do you take these? Is it different times, different people? When would you take it? In the morning, the afternoon, even with food, without food? What's the deal?
So I tell my patients to take it after food, okay. Especially if they have a sensitive gut. The things that I tell them to take before food is when we're working on the gut and in the morning. So when you take it in the morning, you have more energy throughout the day. You feel better. You don't want to take it at night because you're sleeping and you don't want to disrupt your sleep.
That makes sense. That makes sense. I was really curious about that. And then you were talking about, then you were actually mentioning this patch. People like patches sometimes. They have patches for various things. Let's talk about that. These were these is it nanocrystals that stimulate some stuff. Let's talk about that.
Yeah, so this is the patch, and the company is called LifeWave. So basically, it has nanocrystals in the patch, and there's specific areas that you put this on that it works with your body's light therapy. So your light stimulates the crystals, which stimulate your body to produce copper peptides, which stimulate your body to produce universal stem cells to go to the area it needs to help with healing, inflammation, pain. It's worked really well with pain with my patients.
Is there a place you need to place the patch on you, or does it matter?
So if you have pain, I recommend patients to put it on the area of the pain. Okay. If not, then there's certain spots like energy spots that they do, like acupuncture meridians.
Okay.
So you can put one here. There's one on your C7 level at the back of your neck, and under your belly button, and that's it. Those are the spots or the area of the pain.
Okay, wow. And again, you said those are good for, and I love the idea of that. You put it on and the heat, the light makes it do its thing. What was it mainly for? Did you say inflammation, pain?
Pain, so pain, inflammation, sleep, it helps you sleep better. It also helps with, like, if you have let's say an infection or like acne.
Oh, really?
Even,
Okay. Oh,
yeah, yeah, it even worked on my dog. So yeah, it works on pets too. My dog was suffering from an infection for 8 months. He was on multiple antibiotics, from shots to pills, and nothing worked. In 4 days, he got healed.
There you go. I'm like, there you go. That's crazy. I want to ask, okay, so actually, let's explain also to people out there who don't know this. What is inflammation? I want to make sure I get that out to people too, because people are like, I don't know what that means. So what does that mean?
So basically, inflammation can be done to your body through different things. Number one, eating the wrong foods. Okay. So if you're eating sugar feeds inflammation. Okay. And wheat, bread, rice, soy, corn, those kind of foods feed inflammation in your body. So basically your body, when you eat these things, like let's say you eat pizza, right? Your body, instead of like your gut, there's certain things in that pizza that will not only, I don't know have you heard of leaky gut syndrome?
Yes, I have.
Okay, so basically there's certain proteins in certain foods called lectins, and they damage the lining of your gut, which also causes inflammation as well. So your immune system produces an antibody towards certain foods. The antibody is called IgG, and that causes inflammation as well. So what we do a food sensitivity test to eliminate those foods that cause you inflammation.
Yes. I years ago I had gastroenteritis years ago. So that was not fun. I was like, oh, I'll just tell you folks, you don't want it. It wasn't fun. I obviously didn't die from it or anything, but it was just like going to the bathroom a lot and having that feeling of going to the bathroom a lot and just uncomfortability and I felt like I was having contractions. I mean, I remember it was not a fun thing to go through. I was like, oh, your stomach's a lot in your stomach. I did not realize that until I got older. There's a lot in your stomach, isn't there?
Yeah, it really is. It really is. So I've seen it all, but I've seen transformations. Like it's amazing how your body can transform.
So you work with, you're working with, actual science, clearly, in health. you're also working on hormones. There's hormone stuff that you're working with too. Can you talk about a little bit about that? Because hormones affect a lot of stuff too, doesn't it?
Yeah, yeah. So I deal with patients like women that have, hormonal issues and menopause, and but by changing their diet, by helping detox the liver, it helps actually balance your hormones. So I had this one lady, she was like bleeding for like a month,
Yeah.
and they tried everything on her. They wanted to put her on birth control pills. She started with me, and everything has normalized by
Wow.
giving her the customized protocol.
Wow. I think so. I mean, so let's talk me through this. So I come to you like, hi, Dr. Haleh, it's me, James Lott Jr. I said, okay, so I come to you. What are some of the first steps that we do when we're together? I'm coming to you. I said, I've had some back issues, or I've had some pain here and there. I have high blood pressure. And I come to you and like, what do we go through?
So first I do a health history. Okay, so I have to know what happened in the past with you. Then I address your issues. So if it's a back pain, I have to ask certain questions, and then I examine you and I find your cause. Is it or your diagnosis? Is it a joint problem? Is it a muscle problem? Is it a nerve problem? So I do some orthopedic tests to figure out what's going on. Okay, we check your range of motion, set goals. Okay, so if your range of motion is 50% restricted, this is how long it's going to take for you to get better.
Okay.
We do a treatment plan. I also weigh you, okay, to make sure you're at a healthy weight. So basically, I have a scanner that will give me your muscle mass, which is very important. You have to make sure you're gaining muscle in order to burn the fat. We get your fat percentage, so your subcutaneous fat, which is
Yes.
so subcutaneous fat is the fat under your skin, but I also get your visceral fat, which is the deep fat around your organs. Okay, so that comes down a little bit slowly, but it will come down. So then, if your issue is the back pain, then we do the treatment. So we do, if it's safe for you, the adjustments, muscle work. If you have to lose weight, if you're diabetic, then then I build a natural program for you with the customized weekly diets and customized supplements. And I want to make you better. I want to address your problems but find natural solutions for it.
Yeah, no, so is it a process over probably several visits? Probably you do the testing, wait for the test, or can you do it all in one visit? I mean, what's the deal with that?
No, I mean the first visit is the health history and the physical, and then I send you for blood work if you need to do blood work. I do work with a team of doctors as well.
Okay, good.
So if you need the blood work, I send you for blood work. If you need to, like, if you don't have any issues, you don't need to do further testing, but someone that's diabetic really does. So we do the blood work. I send you for blood work. The gut test takes about like a week to come back. The testing, it takes time. So, but we can start the diet right away. Right now I'm working from home, so I am offering my clients, free consult over the phone,
Okay.
and everything gets shipped to them. So shipped and emailed. So majority of my clients are in home, actually, even before the corona.
Okay.
Yeah. But some people like to come into the office as well. So I offer free consults to see if I can help them, if they're a good candidate for the program too. And then I build a treatment plan. So
I like that. I'm going to ask you because you're a professional right now. You can do it virtually on some level. You can have clients virtually.
yeah. So the nutrition and the that stuff I can do virtually. The adjustments, I can't, right?
Yeah, obviously. Yes.
But I can advise them what to do, and which supplements to take that will help bring down pain, naturally, and and what to do at home, which exercises to do as well, which stretches that are safe.
Yeah, that's kind of cool. And folks, you can do stuff at home, man. So think, just make a little space. Even if you have a studio apartment, make a little space. You're ready. I have a yoga mat 'cause I do yoga, so I have a yoga mat. And the little tips for you guys out there, I have flat feet. So I can't do it with socks on. So I had to get a thicker mat. So you can actually get those. I mean, I've been a little tip out there for some folks out there. Some of us have flat feet. It's hard, doctor. It's hard.
It is. So when you have flat feet, you need to wear orthotics. Do
I
you
am.
wear
In
orthotics?
my shoes, I am. But I'm saying, but when
Okay.
you do yoga, my feet are just my feet. I can't. It's hard for me to wear shoes and do yoga for some reason. I can't really. Yeah.
Yeah, it
So
doesn't feel right.
I have orthotics. But my yoga teacher told me though that if I do it long enough, I'll get arches again. She claims this.
Really?
I don't know. She claims it.
Hey, if she claims
I haven't seen it yet. I
it.
like my teacher, but I haven't seen it yet. But she was like, "Oh yeah, don't worry, James. You'll get some arches. Trust me. It may take a few years." But it's like, okay, we'll see. I've had flat feet my whole life. But yeah,
Let me
that's
know
you know,
let me know if that happens.
I'll let you know. But the thing is, when I bring up the feet thing because I feel like it's a lot of our pressure points in our feet, aren't they?
Hmm.
I think as a
Yeah.
chiropractor, you know that, of course. So what are some of the spots where our pressure? I mean, I know feet. Is it head? I mean, where are our spots?
I mean, I'm not like 100% sure of
Yeah.
the pressure points,
Yeah.
but I know there's one by your big toe. I know that one, and I know there's a pressure point here too.
Yeah, I've heard that too. I've heard that.
So I'm not 100% on
Okay.
pressure points,
Yeah.
but those two I know.
That'll work. And what are chiropractors' thoughts on acupuncture? You mentioned it a little earlier. What are you guys' thoughts on that? Do you think it's something that's viable? Is that something that's good?
Yeah. My patients see acupuncturists. They get really good results. I've seen one too for my neck pain. So I love acupuncture. I think it's great.
A lot of people I know who've had chiropractors have had great experiences with them. So
Yeah.
there's something going on there. I think it's great. I mean, that's good. And they've all had my aunts, like I said, my granddaughter. They're all coming out feeling better and better. So I've never been to one, so I don't know. But I'm thinking for everybody I've talked to, they've all walked out with these positive experiences from you guys. That's great. I think it's a great thing. Another
Thank
thing.
you.
So how long have you been doing this?
So I've been doing this since 2008.
Oh wow, okay.
Yeah. I was doing mostly like motor vehicle accidents and, seeing patients for that in Canada. And then when I moved here 6 years ago, I was trained at one of the best functional medicine clinics where I gained all my knowledge for 2 years. And, I went on my own. I'm like, I have this amazing capability to heal people, and I'm so grateful for that knowledge.
You feel like you have an entrepreneurial spirit? That's that kind of thing of yourself, yeah.
Yeah.
I feel
I feel like when you don't grow, you die. So you need to grow.
yes. Anybody else, I mean, besides your sister, you come from a medical or mental health family that did stuff like that? Do you people that did that? Your family?
Yeah, actually, my dad's side of the family, they're medical doctors. But growing up, like my dad was like, he's like 75 now. He takes no medications. Yeah, so growing up, he was always giving us vitamins, and we would get sick or have pain. He would like go the natural route. So that's where I learned that from. He was totally against medications, or he
Why
is
is it great? Because I know a lot of people who don't want to do medication. They don't like the side effects. They don't like the feelings. But I also do know too, you have to be careful with supplements too, right? You have to make sure you kind of work, like you said, you do the comprehensive work on them to make sure that certain supplements work with your body, correct?
Exactly. So every like supplement, it may be safe for me, but it may not be safe for you, right? So again, the health history tells me a lot about the patient. Somebody, let's say, that has kidney issues, you can't give them certain supplements or certain things in the diet. So it's very important that we do that assessment to make sure what is safe for the patient.
Exactly. So I have friends who are like, well, I'll just take this. I'm like, well, you should. They do say on the bottle sometimes, check with the doctor, check with the physician. Just, I mean, work with somebody who knows what they're talking about and knows the supplements. And I like the idea that you get to know you, like it's know you first before you start just, I'm going to take this because I can. Be careful, folks. It's natural. It can still naturally hurt you, right?
Exactly.
That's like the natural part of this. I like all the natural stuff. Dr. Haleh, you're just wonderful. You're wonderful. And it's a pleasure. I'll tell you back on again, talk some more stuff. where can they find you and your products, your business?
So basically, I have a toll-free number. It is 1-833-4BALANCE without the E. So 1-833-422-5262. And my
Very cool.
email.
Very cool.
And yeah, so they can call and book a free consult with me. And we'll go over their health history over the phone, and I'll develop a treatment plan for them, and everything will be shipped and emailed. And the goal is to get you super healthy.
Yes, folks. And we got to take care of ourselves, especially at this time period. Is a great way to get back to taking care of yourself. Shouldn't feel bad or anything. Don't be hard on yourself. Now you're getting knowledge. You know that, I should do this for myself. Do it for yourself. And this is a good time to start while we're sitting at home. Can't really do much anyway. Why not get in better health? And I think this is a great, one of the great opportunities to do this. Is I have this service that you provide. I think it's great.
Thank you. Thank you for having me on here. I appreciate you. And, I think me and you are in the same mindset with, helping people and helping people naturally, and, just spreading love and knowledge and saving lives too.
Yeah, no, thank you. I appreciate that. That's my goal. It's just I'm here to talk to like real people and expose people to all kinds of positivity that's going out there. And you're a positive person that's doing stuff positive out there. The thing is, if you wake up and you're breathing, you can always shape your life. That's the whole point. You can always start. As long as you do those two things, there's always a chance, right? It's a chance for better health, chance for better everything, right?
Exactly. It's again, it's having the knowledge about your body and taking action, right? So that is the key, taking action, knowing what to do too. That's safe for you.
And that's where we'll stop that right there, folks, because that's perfect. That's perfect thing to end on. I'm James Lott Jr. You can follow me where all James Lott Jr.'s are sold, at James Lott Jr. on all social media platforms. Lottahelp.com. That's 2 T's, not one. And then, of course, this podcast, the video versions on my page, JLJ Media. That's my name, James Lott Jr. So JLJ Media, go ahead and like it. I have a host of other great medical professionals, health and wellness professionals, trainers, we were talking about all kinds of things that can help you. So there's an evident playlist. It's got a lot of help playlists, and she will be there, and always will be there. Subscribe while you're there if you're kind. And then for the audio podcast, hello podcast listeners, we will all be on. You can hear our lovely voices talking about this. I know some of you guys can listen while you're walking or shopping or cleaning the house. Go ahead, and it's on everything: iHeartRadio, Spotify, Pandora, Deezer, Spreaker, Apple Pies, everywhere. Like, subscribe, comment, rate. Share this. It's very important. Wherever you hear this or see this, share this when you think might need to hear this or see this. Pass it along. If you have any questions, you can always ask me. If you have questions for her, you can ask me. I'll get you in touch with her, whatever. I'll leave the number for her too, of course. But if you're a little shy, some folks are shy, contact me and I will help you be the conduit to getting in touch with her if you have some questions with her. And everyone, please, as always, stay safe as you can, and try to stay as sane as you can. I know that's an even bigger issue. So please, if you can, try to stay safe and sane.